Welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer, also Program Director, Internal Medicine Residency Program. So we're going to continue our hot topic in-service training examination. These are taken from IT examinations. So today's the topic is going to be treatment of NSAID-induced acute interstitial nephritis. Okay, so how do you manage it? If somebody has been taking NSAID, they can cause acute interstitial nephritis. The first step is always pick the answer, discontinue the medicine. Okay, most crucial step. And sometimes it take significant improvement, but it can take weeks to months. Also remember that. Okay. Now, supportive care, the other supportive care we talk about, you can start IV fluids, monitor, manage the electrolytes, hyperkalemia, metabolic acidosis, and other abnormalities. Dietary adjustment, you want to restrict intake of potassium, magnesium, and phosphate to prevent complications from buildup. Consider phosphate binders if there is a risk of hyperphosphatemia. So now let's go for a question. A 60-year-old woman present with acute kidney injury after taking naproxen for osteoarthritis, despite discontinuing the NSAID, her serum creatinine remains elevated 3.5 milligram per DL. Renal biopsy confirmed acute interstitial nephritis. What's the recommended next step in the treatment? Here, always the first step, they discontinue the NSAID, but the creatinine is still high. So what you should do? You got 4 options, or actually 5 options here. 1, start oral prednisone, initiate hemodialysis, re-challenge with another NSAID, prescribe diuretic for supportive care, observe and monitor renal function without steroids. So the answer is you should start prednisone 1 milligram per kg per day. If renal function does not improve after NSAID withdrawal, corticosteroids are often initiated because an immune-mediated inflammatory response. Okay? So renal function monitoring to assess the progression of the chronic kidney disease is also very, very important. Okay. Renal replacement therapy in severe, if the kidney function continue to get worsened, then you have to think about RRT, intermittent hemodialysis, continuous renal replacement therapy. Okay. Now, this is, we put a algorithm here. The first thing when you have NSAID-induced acute interstitial nephritis, withdraw the drug right away, okay? And again, then supportive care, IV fluids and all that. If there is an improvement, reevaluate after 1 week. If there complete usually response within 1 week, and then you do the standard follow-up. Let's say, going back to the other thing, if there is an improvement, if there is no improvement in serum creatinine, then you have to consider oral prednisone. You can give like 1 milligram per kg, then reevaluate and watch for the renal response, and maintain same prednisone 2 more weeks, and then start tapering and monitor the renal function. Okay. Now, next question. A 50-year-old man with a history of NSAID-induced acute interstitial nephritis was treated with the corticosteroid for 4 weeks. Creatinine returned to baseline 1.2. He is asymptomatic, but he asked about long-term risk of renal impairment. Which of the following statement is correct regarding the long-term monitoring of risk of chronic kidney disease in NSAID-induced AIN? No, we got the options are no long-term monitoring is needed if the creatinine normalizes. B, normal renal function should be monitored every 6 to 12 months for CKD progression. NSAID-induced AIN always progresses to CKD. Recurrent NSAID use is safe after recovery. Renal biopsy should be repeated annually to monitor the progression. So the answer here is the renal function should be monitored every 6 to 12 months for CKD progression. Even though the creatinine in this case is normal, it could get worse later on, because especially if you have fibrosis on the liver, in the renal biopsy. So the word is you need long-term monitoring. Every 6 to 12 months you check it out. The next question, a 45-year-old man, NSAID-induced interstitial nephritis, started on prednisone, creatinine improved from 5 point to 2.0. What's the recommended duration of the corticosteroid therapy? Continue for 1 week and then stop abruptly. Continue for 4 to 6 weeks with a slow taper. Stop corticosteroid immediately once the creatinine normalizes. Taper the corticosteroid in 3 days. Continue for 12 months to prevent recurrence. So what is the answer? Continue for 4 to 6 weeks with a slow taper. Don't stop it like right away. Corticosteroids are generally 4 to 6 weeks, gradual taper. Abrupt discontinuation, my friend, can lead to recurrence of acute interstitial nephritis. Now, next question. 65-year-old woman with NSAID-induced AIN was treated with the corticosteroids. Although creatinine initially improved, a significant side effect, hyperglycemia, osteoporosis. And do we have a next step? What's the next step if the creatinine rises again? So they tried steroids, but a lot of problems, side effect, hyperglycemia, as we know. So what are our options here? Reinstate NSAID at lower dose. Start steroid-sparing agents such as mycophenolate mofetil. Discontinue all nephrotoxic medication. Switch to a higher dose of corticosteroids. Initiate plasmapheresis. The answer is steroid-sparing agent is available. Mycophenolate mofetil. Try that. Okay. Now, another question, 60-year-old male diagnosed NSAID-induced, not responding to corticosteroid after 4 weeks, creatinine remained elevated at 4.2. Which of the following is the next best step? Continue corticosteroid for 4 weeks. Consider alternative immunosuppressive therapy. Reassess the diagnosis and consider other cause of AIN. Start intravenous methylprednisolone pulses. Stop all treatment and monitor for spontaneous recovery. Reassess the diagnosis and consider other causes of AIN is the most appropriate action in this case. If there's no response to corticosteroid after 4 weeks, it's important to look at the other causes, okay? Misdiagnosis, a lot of complications. So again, 4 weeks, no improvement, look for other causes. Thank you so much for watching. We'll be back with another presentation. Please continue to watch our channel. If you could subscribe, support, share, please do that so we can make more presentations like that. And again, once again, study well for ITE, score high, and impress the PD. Thank you. Goodbye.